Have you ever wondered what the positive or negative in your blood group actually means? Why is the rhesus factor so important in pregnancy and blood transfusion? You are welcome to Joyful Talks on Wellness Diaries. This is what we do every Sunday. We try to touchlight all the health matters them, give correct insight and help you take a better decision when it comes to your health. This is me, Joy Ebo. You're welcome. And today with me is Dr. Anima Shehu Ganiyu Olabisi. We want to discuss something that is very, very important today. And what is it? Is rhesus factor. I'm sure you must have heard it, but you don't know what it is, or you know what it is, but you are trying to, try to understand how it works. So today I have a doctor in the house to throw more light on what rhesus factor is. So doctor is a specialist obstetrics and gynecology. She's also the MD of the Solace Specialist Hospital, Lekki. Dr. Olabisi, you are welcome to Wellness Diary. How are you doing?
I'm good. I'm good. Good evening.
Good evening. Thank you for joining us today. Thank you for your time. I sincerely appreciate you. Thank you so much. So now let's go straight into the matter we have at hand. Rhesus factor. What is rhesus factor? I want you to explain it in a way that even a layman will be able to understand. Then we can, discuss other things that comes along with it. So explain to us what rhesus factor means.
Okay. So rhesus factor, in a layman term, is a protein or an antigen that is present on all red blood cell
Okay? Can you hear me? Oh, network.
The name was gotten from
Okay.
discovered. Yes, I can hear you.
All right.
I can
So
hear you.
please, you may
I can
have to
hear you.
come again so that
So I was talking
because there
about how
was
the name was
a
discovered.
glitch. There was a glitch there. So just maybe you have to start all over again. So what resource you are trying to explain what resource factor is?
Yes, I was saying that the rhesus factor is like a protein. It's a protein on all red blood cell membrane. Am I audible? I
Yes.
said that the name was gotten from, yes, it was discovered by them. It was gotten from a monkey, one of the monkey in the past. So that was why the name came to place,
Whoa, from
Rhesus.
a monkey. Please,
So
we would like
yes,
to see your face. You may have to adjust your camera exactly so that we can see your face. Thank you so much. All right. So you are saying it was discovered from a
okay,
monkey.
yes, Rhesus, the monkey named Rhesus. So it is an antigen. Antigens, some antigens are protein. This particular one is a protein, and it is found on all red blood cell membrane. So this Rhesus is a Rhesus D, capital letter D. That are the alphabet, capital letter D. So it could either be present or absent. And normally, genetically, a fetus, a baby, takes 50% of the genetics from the mother and also 50 from the father. So when it takes from the mother and the mother is negative, it means that the baby will become resource negative. The baby will not have that resource. When you have it, you are positive. That's resource D positive. But when you do not have it, you are resource D negative. So
Whoa.
majority of people have it. 85% of people have it. So 85% of people are resource D positive.
Okay, Dr. Labisi,
Then the
I,
remaining
we
15%
are going
are
to take
resource
it
D.
little by little, slow and steady, because I would like a lot of people to understand what this thing means. So now you have explained that you said that 85% of people have this resource factor we are talking about. Now, how does it, differ from the normal blood group system? We have blood group A, blood group B, blood group AB, then O. So how does it differ? I want you to throw more light on how it differs from the normal blood group system.
Okay, so the normal blood group system, those ones are also antigens that are present on the red cells, but those ones are they have their names. We have A, we have B, we have AB, and we have O.
Okay.
So there we have A antigen, B antigen, AB antigen, and O antigens. So for this one is just the resource part of it. This is the resource part of it. So this the resource is resource D. It is either it is positive or it is negative. It is present or absent.
Okay. Is it inherited?
So for every human being, so yes, like I mentioned earlier, it is inherited. So a fetus, a baby, inherits 50% of the genetics from the mother and 50% from the father.
Okay.
So we could either, yes, get from the mother or from the father. So whichever comes first. Now, for this difference between A, B, O, and rhesus. So basically, the ABO, AB, and O, they are naturally occurring AB antigens.
Okay.
Are we on the same page? Yes.
Yeah.
But for the other one, it could either be present or it could be absent. That's the resource D.
Okay.
So now for this, they're antibodies because for ABO, we also have the antibodies. The antibodies are naturally occurring, they occur naturally. But for rhesus, the antibodies only occur when they are sensitized. Shed more light on that as we go.
Okay. All right. So you have a
As the discussion proceeds, yes, as I
yeah.
proceed in my discussion, I'm going to shed
Uh,
more light on that.
all right. All right. So now let's talk about the RH. Is it okay for me to call it RH, rhesus factor? So the
Yes, for layman, you can use the word RH, but it's called rhesus factors.
Rhesus factor. Okay, so
Rhesus,
for
yes.
rhesus factor, so why can it be how will I put it now? The incompatibility be dangerous during pregnancy? Because I know that a lot of people do not bother, or they are not disturbed about it until they are pregnant. I'm talking about women now. Until a woman is pregnant and she's in the hospital, maybe during the antenatal period, then they will have to check. So why is it an issue? Why is compatibility an issue when a woman is pregnant? Can you run us, through the challenge that comes with it, especially if a woman is positive with it during pregnancy?
Okay, so this is it. Let me explain this and let me shed more light on this.
All right.
Now, like I said, that the rhesus factor is an antigen.
Okay.
So for an individual that doesn't have it, the individual is termed rhesus negative, is considered negative. So we call them rhesus negative individual.
Okay.
So for a woman, if she is rhesus negative, there will be no problem if she is not, if there are no reactions. And the only way you can have reactions is when you come across a positive, a rhesus positive.
Okay.
It is only when you come across a result, because that is when the antibody will be developed. But that negative, that result is an antigen. So when antigen and antibody come together, they react.
Oh.
So now, if a woman is resource negative and she's carrying a baby that is resource negative, negative and negative,
Mm.
they be the same now. So no reaction.
Yeah.
Now, only when they
Yeah.
differ, maybe one is negative, one is positive, that there will be reaction.
Positive. Yeah.
So if the if the baby she's carrying is negative, there will be no reaction. So no antibody is formed. It's just that antigen that is in a cell. And the woman go dey go, nothing go happen to am. Im
Mm.
go feel alright. But
Okay.
if she carry a baby wey get rhesus positive, maybe the baby got it from im papa. You know, I
Okay.
say I talk am
Because I
for the
was
beginning,
about to
say
ask,
the baby can either get it
does it
from the
affect
papa
men
or from
too?
the mother.
Mm. Go ahead.
Yes, yes. So for men can either be negative or positive too. But because
Okay.
a woman is carrying a baby, is the one carrying a baby, and the blood cell the blood of the baby is positive and the woman is negative, you know say the woman na negative, the baby na positive, so there go be reaction, no be the same
Yes.
cell. So the antigen and the antibody they go come dey fight. So that is what is dangerous.
But if the woman is
Once they
negative,
start
if the
fighting,
woman
there
is
will be a
negative,
reaction.
if the woman is negative and the baby is negative, it's fine. But if the woman is positive, baby is negative, there will be a reaction. That is what you are trying to explain.
Exactly. Or if the woman is negative and the baby is positive, any
Positive.
of the two.
Okay. So a woman must be
So
negative and the baby negative for it to be compatible.
thank you. So when a woman is negative, you need to check. It is very important to check if the husband, you check the husband's own. If the husband is negative, there is no problem. In as much as she's carrying the baby of the husband. Because you can't know what the baby is carrying. But if the husband is positive and the woman is negative, you need to do a check.
Okay, thank you so much.
So as we progress, we are still going to talk about it.
All right, thank you so much. Now it's beginning to be clear, to me, because while I was pregnant, this was, I had to run this test, and I didn't understand what was going on in my body at the time. Now, as the doctor is explaining it better, I'm beginning to understand it, and I also want you, to join this conversation and put your ear down so that you can understand how these things work. This is Joyful Talks TV, and this is Wellness Diaries, and this is what we do every Sunday. We try to touchlight all those important health matters, so that when you come across them, or when you hear them, you will know what it's all about, and it will also help you to make a better decision when it comes to your life and when it comes to your health. You can subscribe to my channel at Joyful Talks TV, and I've been talking about Rhesus factor. I know a lot of you must have heard about Rhesus factor, but you don't know what it means. Some of you, if you don't have it, if you are negative, you don't get to know what it is. Whether you are negative or positive, it's also important that you know how these things work, and it's also important that you know how these things work and how it reacts in your body. You can, so that you be able to, give advice or talk to another fellow woman, and educate another person near you, or that is having the issue. So now let's go back to Dr. Olabisi. So how does anti D? I know that when tested and there's a reaction, and there's something that is done, right? When a woman is tested in the hospital and there is reacting, maybe the woman is positive and the baby is negative, and there is a reaction, what
Exactly.
is there a way out? Is there something that can be done? Is there an injection? I don't want to, sound more like a doctor now. That's why I have you. I've researched, and I know that there is a anti-D injections, and but I want you to explain to us better how these things work. So when a woman is tested and is positive and the baby is negative, and there is a reaction already, what are the things that should be done, or that could be done, to um pervert any danger?
Okay, so audible.
I can hear you, so go ahead now. Network is trying to be funny, but I can hear you all the same, so go ahead.
Please, am I audible? Can you hear me?
I can hear you loud and
Okay, so
yeah.
to the question. Now,
Yeah.
what is negative? That's where, yeah, that's where our concern is. That is where the concern is. When a woman is negative, every woman that comes to antenatal, a pregnant woman comes to meet you in antenatal, is you screen the woman. You check her ABO screening, you check her you want to know, you are concerned about her resource factor and her ABO. Is she O negative? Is she O
Positive.
very important? Negative. O negative. Now, when she comes, she's O negative. You want that, and that is her first pregnancy, a very first pregnancy. Most of the time, what we do for them is we ask for the husband, ABO, compatibility, and rhesus factor to be able to if the husband is also O, the husband is O, and sure that the baby too will most likely be O negative. So if the woman cannot produce her husband's result, you go ahead with the woman. Then what do? You do for that woman, you want to do an indirect Coombs test. That is to show if the woman has been sensitized, if the woman has had a reaction in her system, a
Okay.
reaction that is against her blood O negative.
Okay.
Maybe she's been pregnant before, she had an abortion, she's been exposed, you understand? So you want to know if the Coombs test is negative. What you need to do is just to give the woman a prophylactic injection. That's the Rogam. That Rogam is the immunoglobulin, anti-immunoglobulin. Woman is given a prophylactic dose. You can give it at 28 weeks and she delivers. So it even protects her. Yes, you can give the immediate she delivers up to 28 days after.
Is that what they call anti-D
So
injection?
yes, that is what they call anti-D. That's the Rogam. So
Oh,
you give to the woman because you know you.
okay. Okay. Now, hello, can you hear me? We are having a very bad
So
and terrible network, but go ahead. Go ahead, Dr. Labisi. Hello, can you hear me? Dr. Labisi, can you hear me? Can you hear me? Oh, okay. This is Joyful Talks TV and your
all possible.
Wellness Diaries. Okay, now I have Doctor back. So can you hear me? We are trying to explain what could be done if a woman is tested positive. There's an injection that is given to the woman, to um, prevent the complication. So you can go ahead if you can hear me.
I can hear you clearly.
All right, so go ahead.
Okay, so I was saying that the first pregnancy, the woman gets sensitized. Then the subsequent pregnancies, she starts manifesting symptoms.
Okay.
So you avert all of that
So
in your
what are the
first
symptoms? What are the symptoms
pregnancy by
now?
giving the
So what are the
anti-D
symptoms now?
program.
Because I know that sometimes some women don't start their antenatal early. Some may be pregnant for first trimester and they will not start their antenatal early. So what are the symptoms that will have to present before a woman will know that that this is a complication from Rhesus factor?
Okay, so please let indicate if I'm audible.
Yes, I can hear you. Go ahead. Did you hear my question? Doctor, did you hear my question?
Hello, please indicate if I'm very audible.
Yes, you are. Go ahead.
Yes, I hear your question very well. You were asking me of the complications, of the symptoms.
Yes. How can a woman know?
Okay, so let me go straight to the question.
All
The
right.
symptoms.
Hello, doctor.
Okay, can you hear me now? I
Yes,
think
I
the
can.
network is back. It's back now.
Yes,
I'm back. I'm
it's
fine.
terrible,
Okay, so
but
let's
yeah, go ahead.
complications.
Yeah.
So when a woman comes late for antenatal, and then she has the complications that started what's it called taking place in her. The fetus most of the time are usually affected. What are these affectations? One, the baby will start having anemia. Anemia means the pikin blood go just dey come down, e go dey low, it will be coming down, and the baby will be having blood loss, as in reduced blood volume. So blood no go plenty for the baby body, and that baby, if care is not taken, baby can die. It could lead to stillbirth. They can just have sudden death. It could also make the baby get the baby body eyes yellow. They could have jaundice.
Jaundice.
They could have that jaundice that would affect their brain. Yes, that one that will go to their brain, causing them to have clinic terrors. It could result into that. It could also affect their liver. You know, their liver is not well developed when they are very small. So
Yeah.
it could damage their liver. It could also affect their heart. It could damage the heart too. So there's this fascia that they come. There's a way they look. Those babies, they look. They call them erythrobastolis fetalis. The way they look, they are not well formed. It affects most of their system. So it is best that we do the necessary. Once we are aware of our resource factor, we know we are resource negative. A mother that is resource negative should be careful, should go to an hospital for antenatal care early, so that she can be screened, she can be investigated, and she can be taken care of.
Thank you so much. Now, let's move away from pregnancy and women. Now, let's talk about blood transfusion, because I know that it's not just when a woman is pregnant that rhesus factor is being checked. So when somebody want to maybe donate blood, or when there's any need for blood transfusion, those things are also checked. So why is it an important thing for rhesus factor to be checked when there is a blood transfusion?
Exactly the same thing we have been discussing. Now, because of the reactions, now a woman, or maybe a woman, but most, let's just put it that way, a woman that is O negative, it is better to have O negative blood transfused into her, so that
Okay.
there will not be cross reactions between
Okay.
the negative and the
The
positive. You know,
positive.
like I talk am, I
Yeah.
say if na negative negative, no no no, e
No
fine. But
reaction,
when
no
the two of them
complication.
they differ, na problem.
So it means that so for somebody that have a negative, when you are taking when there is blood transfusion, you should also look for a negative.
Exactly.
All right, thank you so much.
So that is what we do. We ensure that, yes, we don't have a yes.
Thank you so much. In fact, I would have loved us to dig deep into this conversation, but network is playing wayo on us this evening. So this is where we have to draw the curtain. Thank you so much, Dr. Olabisi Ganiya Animasheun. Thank you for your time. Thank you for coming on Wellness Diaries on Top Joyful Talk TV this evening. And thank you too for my viewers. Thank you for your time, and thank you for learning. Don't say rhesus factor is not I don't have it, and because of that you don't want to learn, you don't want to know what it means. You can advise someone, you can be informed. Remember, if you are not informed, I don't want to use a negative word, but now, if you are not informed, you will be making a lot of mistakes, especially when it comes to your health. So you need to be informed, you need to hook up to this channel so that you can get valuable insight, things that will make you think twice and think about your health and about your life. Thank you so much, Dr. Olabisi is the MD as the Solace Specialist Hospital, Lekki. Thank you so much for your time. I really appreciate. We'll do this again next time, and I pray that network will be favorable to us. This evening it was really, really horrible, but thank God we're able to achieve this. Thank you so much. Till we meet again next week, I want you to remain healthy and wealthy. Thank you, and God bless you. Bye.
Bye.